All right, today we're going to talk about two of the most fundamental, most critical measurements in health: your pulse and your blood pressure. But I want you to stop thinking of them as just numbers. Instead, think of yourself as a detective. These aren't just stats, they're vital clues. And we're going to learn how to read the story your body is telling us. So let's get started. But here's the thing, and it's a really big deal. As important as these vital signs are, they are also some of the most frequently messed up measurements. And getting this right is absolutely crucial. A wrong reading is like finding a bad clue. It can send your entire investigation down the completely wrong track. So every good investigation starts with the first piece of evidence. For us, that's the pulse. It's the easiest clue to find, and it's like a telegraph from the heart, tapping out messages all over the body. So how do you actually gather this clue accurately? Well, we start at the wrist on the thumb side. That's where you'll find the radial artery. Now, now here's a pro. Use your index and middle fingers. Never use your thumb because it has its own pulse and you'll get confused. Press down gently till you feel that beat. Once you've got it, count the beats for a full 30 seconds. Then just double that number and boom, that's your pulse rate. Now, that number you just found, it's the first sentence in the story. A normal resting pulse for an adult is usually somewhere between 60 and 100 beats a minute. If you find it's cranked up over 100, we call that tachycardia. And if it's way down below 60, that's bradycardia. Both of those are really significant clues that tell us something might be going on with the heart. But hold on. A good detective knows the first clue is never the whole story. The rate is just the start. We also have to think about the rhythm. Is it steady as a drum beat, or is it all over the place? What about the strength? Is it strong and easy to feel, or weak and thready? You even want to check both sides of the body to see if they match. And this is where the quality of the pulse gives you so much more information. For instance, a weak kind of thready pulse can be a major warning sign for shock. On the flip side, a really strong bounding pulse could point to something completely different, like anemia or even the very early stages of septic shock. And this brings us to a huge red flag: an irregular rhythm. If that beat isn't steady, that's a clue you just cannot ignore. It could be pointing to something like atrial fibrillation, which is when the heart's upper and lower chambers are out of sync. It's a really big deal. Okay, next up, we're going to grab a quick piece of supporting evidence. It's a fast but really powerful test that tells us about circulation, and it's called the capillary refill test. So here's how this works, and it's brilliantly simple. All you do is press down firmly on a fingernail bed for about 5 seconds. You'll see it turn white as the blood is pushed out. Then you let go and you just watch, because the magic number here is 2. The color should rush right back in under 2 seconds. If it takes any longer than that, well, that's another clue. It might point to poor circulation, maybe dehydration, or in a really serious case, it could be another sign of shock. It's a fast, simple test that adds a really important piece to our puzzle. All right, now it's time for the main event, the piece of evidence that can really crack the case: blood pressure. This gives us a direct look at the force inside the arteries. But, and this is a big but, getting it right takes real precision. You know, the key to getting an accurate reading actually starts before you even inflate the cuff. You have to set the stage perfectly. The person needs to be sitting down, relaxed and quiet, for at least 5 minutes. Their arm has to be supported at the same level as their heart. And maybe most important of all, you have to use the right size cuff. It needs to wrap around about 80% of their upper arm. So when you've got the stethoscope in your ears, what are you actually listening for? It's not the lub-dub of the heart. You're listening for something called Korotkoff sounds. It's a fancy name for the tapping noises the blood makes when it starts to flow back into the artery that you've squeezed shut. Here's the play-by-play. Get the cuff on. Inflate it about 30 points higher than where you stopped, feeling the pulse at the rest. Then you start to let the air out slowly and steadily. All the while, you're listening with your stethoscope. You're waiting for two key moments. The very first moment you hear that clear tap, tap sound, bam, that's your top number. That's the systolic pressure. It represents the peak pressure in the arteries right when the heart contracts and pushes blood out. And as you keep letting the air out nice and slow, you'll hear those taps get quieter until they disappear completely. The exact moment you can't hear them anymore, that's your bottom number, the diastolic pressure. This is the pressure in the arteries when the heart is at rest, just relaxing between beats. Now, just like any good investigation, our evidence can get contaminated. So let's talk about the common mistakes that lead to bad readings and the modern tools that help us get it right. So here are the usual suspects. The top ways an investigation gets derailed. Deflating the cuff way too fast is a classic error. Not supporting the arm properly can totally throw off the numbers. Even something that seems innocent, like rounding the numbers to the nearest zero, can mess up your findings. But if there's one mistake, that is the absolute number one villain, the one you must avoid at all costs. It's using the wrong cuff size. It's so important. A cuff that's too small will give you a reading that's way too high. One that's too big gives you a reading that's way too low. It is the single most critical variable you need to control. Of course, these days, a lot of us are using automated machines, and they're great. They're a fantastic high-tech tool for the modern detective. Instead of you listening for sounds, they work by actually feeling for tiny vibrations in the artery, which takes a lot of the guesswork out of it. But, and you knew there was a but coming, the fancy technology doesn't replace good technique. The basic rules of the game still apply. You absolutely have to use the right cuff size. You have to position the person correctly. The machine is only as good as the detective using it. So we've gone through all the clues and all the techniques. What's the final verdict? What's the big takeaway from all of this? The most important thing to remember is that pulse and blood pressure are so much more than just numbers. They are a direct line of communication, a language the body uses to tell its story, whether it's a story of health, stress, or trouble. And when you learn to measure them accurately, it's like you're becoming fluent in that language, and you're learning to hear the story with perfect clarity. And that really leads us to one final, thought-provoking question. Every single second, your body is sending out these signals, these crucial little clues about everything that's going on inside. The question isn't whether your body is talking. The real question is, are you listening correctly? If you liked the video, click like and subscribe to the channel. Click the bell to get notifications about new uploads.